Medical Watch is sponsored by UChicago Medicine, bringing expert primary and urgent care close to home with locations throughout Chicagoland. Schedule online at uchicagomedicine.org.
On the Medical Watch, a gentler way to treat prostate cancer.
Medical reporter Dina Bair has more on the emerging treatment and who can benefit.
It's about reducing, even eliminating, what can be significant symptoms for men who have their prostate removed or radiated. Local doctors have spent a decade honing a less invasive technique. It's welcome news for men who may avoid treatment due to the potentially debilitating side effects.
Papa. Good throw.
It's one of the best chapters in Tony Romano's life.
I have 3 grandchildren, 3 grandsons, so I spend a lot of time with them.
Time with family is even more precious after the retired English teacher's 2021 prostate cancer diagnosis.
PSA numbers kept going higher, so when they got to about 9 or so, I opted to have my prostate removed entirely. But there was some complications, so in the middle of the surgery, he had to stop.
The plot twist meant prolonged problems.
I was having some problems voiding, which is a polite way of saying peeing.
But ultimately led him down a different treatment path.
I didn't know about focal therapy at that point.
We really believe there's a new, responsible way of doing it.
Dr. Sri Verganti has been working on gentler prostate cancer techniques for a decade.
When you remove a prostate or irradiate it or anything that can impact cancer, it can really impact both your urinary quality of life and your sexual quality of life, no matter how careful we are.
What's called focal urology aims to eliminate or greatly reduce the side effects. Advancements in imaging drive the science.
We have MRIs, we have new pictures that we use, and we have specialized biopsy techniques where it actually tracks our biopsy needle in real time.
The urologic oncologist likens the approach to a lumpectomy for breast cancer patients. He showed us how it works in the Rush simulation lab.
Now the probes span that lesion, and I can apply electricity just between that area.
Instead of removing the entire gland, probes target a single lesion and emit electricity to destroy only the cancerous cells in the prostate.
We use very high voltage electricity to overwhelm the cell's ability to maintain its cell wall. And it pokes tiny little holes in the cell, so it basically dies. The best candidate has exactly 1 lesion, and they have cancer that's not low risk and not high risk, but in the intermediate risk, and it's just in that area.
So it seemed like it was too good to be true. It was a single treatment. I'd go home with a catheter and for about 3 or 4 days, and that would be it. There were no complications, no side effects, and I got my life back, I think.
You want to put the sauce on?
In Tony's case, a recent biopsy and blood work checked out. The 66-year-old got the all clear. A recent study noted an 89% rate of freedom from cancer 6 to 9 months post-treatment.
Yeah, huge relief off my shoulders to be able to be cancer-free and not have any side effects.
If patients have a recurrence down the road, they can repeat the focal procedure. Back to you.